Hi, in this video I'm going to talk about the 5 Geriatric Giants and the things that I have learned in my Geriatric Rotation.
We don't fight them with ODM gears like in Attack on Titan. Listening is treatment.
Watch till the end of this video and I'll sing you a song.
我是刘德华。
Have you ever noticed how a simple fall can become a life or death crisis in an elderly patient? You hear whispers, someone's grandma fell, went to the hospital and they never came back. So why does such a simple fall can become so serious? Let me explain. So I just wrapped up my 3 months geriatric training in my government hospital, and let me tell you, it really opened my eyes in ways I didn't expect. In this video, I'm going to talk about 2 main topics. So the first one is some often overlooked problems in elderly care, and the second one will be the challenges that I face, that we healthcare workers face when treating elderly patients. So if you are a medical student, a doctor, or who is someone currently taking care of your elder parents, please watch to the end of this video. This video is for you. So in Malaysia, the geriatric population rose from 10.3 to 11.1 between 2020 and 2022, and of course, the number is still rising. On my day 2 of geriatric training, my geriatrician taught me something that I will remember for life. So you might ask, why not day 1? The reason is because she was too busy chit-chatting with patients. She sat down with them like they were old friends catching up, drinking teh tarik. No teh tarik lah. Even if there's teh tarik also, even if there's teh also, it will be a teh all. So at first I was like, wow, so free one. Geriatric not bad, chill, good. But then later, much later, only I realized this is a geriatric medicine. Listening is treatment. So on day 2 of my rotation, she took out a piece of paper and a pen. She wrote down on the paper with capital letters, the 5 Geriatric Giants. They call these giants because they got the Cascade effect in them. So the first one is immobility, second giant is instability, third one is incontinence, fourth is impaired cognition, and the fifth is Iatrogenesis. Now don't worry, these 5 giants is not like the giants in Attack on Titan like Eren Yeager that will stomp your city, wiped out the population. These giants do have the potential to quietly wipe out our elderly, not with the Titan storm but through a slow, devastating chain reaction. According to World Bank, 10% of world's population in 2024 is actually more than 65 years old. This giant won't destroy the world, but they will dominate the clinical picture and trigger a cascade effect. One giant leads to another and another and another until it is too late. So let me share a real case. Mr. Bond, James Bond, licensed to fall. He was admitted for altered mental status. That time he was treated as an infection, completed a course of antibiotic and discharged well. But 1 week later, he's back into the hospital with the same complaint. The family member brings him here, tell me, hey doctor, my dad for the past few days can't really recognize himself. It's like talking nonsense. What to do, doctor? What is our plan in hospital? To admit into the hospital, give stronger antibiotics,
Therapy, no.
and discharge again? No, of course no. So luckily he was admitted into the hospital and referred to Jerry team. So when primary team referred the case to Jerry, what we usually do is I'll grab a pen and a piece of continuation sheet and set in front of the landline, pick up the phone and call. Why landline? Because I really don't want a family member, some random family member, to keep calling me 3 AM in the middle of the night or send me love letter 2 AM in the middle of the night. Sometimes I really think, I really hope I can bring earphones to hospital, because holding my phone in this position for about 30 minutes every day for a few times is really tiring. No amount of shoulder press can train your shoulder for this. So then came to the CGA, Comprehensive Geriatric Assessment. That means we ask a lot of questions From your grandfather and grandmother until your grandchildren, grandson, everything we covered. What you eat, what you drink, what you do from the morning until the night. What happened during last Chinese New Year? What happened during last Deepavali? Does he remember the name of the far siblings? If he goes to the bank, does he remember all the PIN number himself? If someone comes to the house and want to change the gas stove, did he go out and then let the people come in, or someone needs to come to the home and invite the people? After a full assessment and a full history taking, turns out Mr. Bond was falling repeatedly at home, and that fall, it was just a start. Fall will lead to fear of fall, pain, and then causes immobility causes sarcopenia, then instability make patient mostly bed-bound, frail, incontinence. When there's incontinence, there's social withdrawal, frequent catheter insertions, make patient always bed-bound, causing lung infection and DVT, cognitive decline, memory loss, and mood issue, admitted into the hospital, insert the cannula, insert the catheter. So cannula got bung, infection is there, give all the medication, drug interaction, infection, start meropenem, polymyxin, ESBR, MRSA, and then James Bond, this is the end. So the full diagnosis when he was warded, hypoactive delirium secondary to recurrent fall, recent admission, electrolyte imbalance, infection, dehydration, and risk of fall, secondary to a multifactorial, bilateral eye cataract, bilateral knee osteoarthritis, history of stroke, instability, cognitive, mood, environmental factor, nutritional factors. Lots of all this, but if you have a look, if you write it down on a piece of paper, you realize all this actually comes down back to the 5 main geriatric giants. We don't fight them with ODM gears like in Attack on Titan, but with proper care strategies. For example, instability and immobility. Other than physiotherapy, we always encourage patients to do lightweight exercise. There is actually still taboo around elderly people. People say things like, "Aya, too old already lah. Little fall how? Exercise no need lah. Just let them eat and rest." This is a mistake. Regular strength training and stability exercises is not just important for youngsters but for elderlies as well. We are not asking you to go to the gym, lift 20 kilos biceps. Alright, you don't need a big biceps to stay healthy. I always tell patients, a car is meant to be drive on the road, and a ship is meant to be sailed in the sea. And we human is meant to move around, talk, walk, do something, walk around, do something, eat something, drink water, sleep well. Alright? So because by promoting immobility, we are actually indirectly causing more and more sarcopenia. So when sarcopenia happens again, the cascade comes: sarcopenia, instability, immobility, incontinence, impairment condition, hospital, disease. Movement is medicine, not just for the young, but especially for the old. The key is to identify these giants early and stop the domino effect. So coming to the second topic, which is the challenges that we healthcare workers face when giving a geriatric care. So the first one is, of course, time and energy. We are tired, system is overloaded. Sometimes when you meet the irresponsible carer who dump their parents in hospital like it is a daycare center, some even got, irritated when our CGA takes a longer time. At first I was like, wow, so rude, wow, son like this, irresponsible. But then when I really dig deeper into the story, I can almost always find an exhausted carer. We got a specific term for this, we call it carer stress. Sometimes I can find a family member who have tried everything, given all the time and energy they can, but still see no and near zero improvement in their elderly parents. Can you imagine how devastating is that? Judging is easy and empathy takes effort. So this makes me realize our job is not, to just treat and then to scold when we see something that we don't like, but to actually communicate, guide, and teach. This is really something that I learned only during my geriatric posting. Sad to say maybe I lack empathy or what. So the second challenge that I faced during my geriatric training is actually language barrier. Can you imagine me, the Chinese in Malaysia? I speak Bahasa, English, and Chinese. I thought it's enough, but no. Elderly patient prefer dialects. So China they can talk Hokkien and Cantonese. During that posting, my Cantonese literally went from broken Cantonese until being so fluent until one uncle asked me if I'm Andy Lau, Unfortunately, my singing voice says otherwise. But it made a huge difference when you speak that dialect. They trust you more instantly. It's like they open up. They just talks more, I feel like that's half of the battle in geriatrics already. So it's hard to cover everything in one video, These Geriatric Giants are huge after all. If you like this kind of video, just use a giant thumb to like, subscribe and share. I'll post another video anytime I feel like it. No schedule, just vibes.
刘德华，
沉沉睡了，誰分享今生的日子？活着但是沒靈魂，才明白生死之間的意思。